Welcome to Clinical Tools Library, evidence-based skills and questionnaires designed to support healthcare professionals in practice. The test of pragmatic language assesses an individual's pragmatic language skills, focusing on the ability to use language effectively in social contexts. It evaluates skills such as understanding and expressing intentions, interpreting non-literal language, following conversational rules, and adapting communication to different situations. The test is designed to identify pragmatic language impairments often associated with conditions like autism spectrum disorder, traumatic brain injury, and social communication disorder. Its main purpose is to provide clinicians with standardized, objective measures to guide diagnosis and intervention planning for individuals with communication deficits affecting social interaction. The test of pragmatic language is indicated for children and adolescents aged 6 to 18 years who exhibit difficulties in social communication. It is particularly useful for individuals with developmental disorders such as autism spectrum disorder, attention deficit hyperactivity disorder, and specific language impairment. The assessment is applied in clinical settings to identify pragmatic language deficits that impact social interaction and academic performance. Studies demonstrate its utility in differentiating social communication challenges from other language disorders. The test provides objective measures to guide intervention planning and monitor treatment progress. The test of pragmatic language consists of 45 items that assess an individual's ability to use language effectively in social contexts. The examiner presents brief stories or scenarios and asks the examinee a series of questions relating to implied meanings, intentions, or social cues. The response format includes multiple choice questions and open-ended responses, requiring verbal answers that demonstrate comprehension of pragmatic language aspects such as inference, humor, and perspective taking. To administer the test, the examiner reads each item aloud, records the examinee's responses, and scores them according to standardized criteria. Scoring involves assigning points based on the accuracy and relevance of the responses, with total raw scores converted into standard scores using normative tables adjusted for age. Standard scores around 100, with a standard deviation of 15, indicate average pragmatic language ability. Scores below 85 suggest difficulties in pragmatic language skills, warranting further evaluation or intervention. Percentile ranks and confidence intervals accompany standard scores to provide additional insight into the examinee's relative performance compared to normative samples. The sensitivity of the test of pragmatic language reflects its ability to correctly identify individuals who have pragmatic language impairments. In clinical studies, the test of pragmatic language demonstrated sensitivity values ranging from 0.75 to 0.85. Sensitivity indicates the proportion of true positive cases detected by the test. Specificity, on the other hand, measures the test's accuracy in identifying individuals without pragmatic language deficits. Reported specificity for the test of pragmatic language typically ranges from 0.8 to 0.9. This means that the test correctly classifies unaffected individuals at a high rate. For example, a sensitivity of 0.8 indicates that 80% of individuals with pragmatic language difficulties are correctly identified, while a specificity of 0.85 means that 85% of those without such difficulties are accurately excluded. These metrics support the test of pragmatic language's utility in distinguishing between affected and unaffected populations in clinical contexts. The test of pragmatic language was originally developed by Laurie Johnson and colleagues in the mid-1990s to assess social communication skills in children and adolescents aged 6 through 18 years. Validation studies conducted by Johnson and colleagues demonstrated strong internal consistency with Cronbach's alpha coefficients ranging from 0.80 to 0.90 across different test forms. Test-retest reliability was also robust, with correlation coefficients exceeding 0.80, indicating stability over time. Further research by other investigators expanded the normative sample to include diverse populations, affirming the test's construct validity through significant correlations with related language measures and behavioral assessments. Factor analyses supported the underlying theoretical framework by identifying distinguishable pragmatic language components, such as contextual appropriateness, conversational understanding, and nonverbal communication. Sensitivity and specificity metrics reported in clinical samples suggested acceptable discriminant validity in differentiating individuals with pragmatic language impairments from typically developing peers. Overall, the test of pragmatic language possesses a foundation of empirical evidence and psychometric rigor established through multiple investigations since its inception. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.